Hello, my name is Matthew Levin, and I'm going to be doing some palpations on the upper axial thorax region today. This is my partner Sam, and I'm going to ask him first permission. May I have your permission to do some palpations today?
Yes.
Thank you. Hello again. So now we're going to be doing some palpations on the anterior portion of the body. So first, I'm going to identify his clavicle, which is right here. I can feel that the acromioclavicular joint all the way down to the sternoclavicular joint. And then also I'm going to have him flex his head forward. And I can also see that sternocleidomastoid attaching to that manubrium. And right this area is called the sternal notch. Next we're going to be moving down. May I adjust the cloth?
Yes.
So now we're going to be moving down to the sternal body, down to the xiphoid process, right in this area. Now we're also going to locate the first rib. So the first rib can be distinguished. It's right in between that SCM, sternocleidomastoid, and the trapezius. One way we can really feel it, I can feel the superior angle of the scapula. So I want to go deep to it. You can feel it by just inferior to the clavicle. You have the first rib, and you can follow it down underneath the clavicle. You put your thumb right in there. If you have your volunteer shrug the shoulder, and relax. Again, shrug your shoulder. Good, and relax. You should really feel that portion. You should not feel any movement from that first rib. If you do, that you're on the superior angle of the scapula. Now we're going to go to the ribs on the anterior side. So the first through 6 ribs are going to be attaching at the sternal body, so you can feel them right in here. But then 7 through 10 ribs are going to connect to the main portion of this costal cartilage. So 7 through 10 ribs are going to be attaching right at that costochondral joint, and then they're going to be attaching right along here at the sternal body. Hello, so I'm going to be showing you the posterior part of the thorax. So we have a few bony landmarks that we can identify on the posterior side. First, we're going to find that most prominent part in the cervical, that C7 area. It's really, really bony, and you can really find that very well. And just right under that's T1. From there, we can really feel, and also we can really feel underneath the traps where that first rib is going. So again, right in there. And then we locate his spine of the scapula, and then we're right there should be T3. And then as we go down on the medial border, we find the inferior angle of the scapula. We're going to go medial to both of those, and we should find T7 or T8. And then as we follow along the spinous processes, you should go down and feel all the way down, and you should feel the last couple of ribs here. You should feel that T12 and follow all the way up, or that 12th rib, and then you should find that T12 process down here, up here. And then just superior to that last rib, you should find T11, and you just follow that rib all the way up to T11. Alright, so now that we've found those bony processes in the spine, this is the spinous process. So you can really feel this right along there. Definitely feel all those spinous processes. And then just going lateral to that, right in there on the side, you should feel those transverse processes right in there. So about 2 inches on the spinous processes, you really feel those transverse processes. And right below that transverse process, you're going to have those costal vertebral joints. So you can really feel those moving up and down. So right in there. Get right in there. And then in between the spinous process and the transverse process, you're going to have a laminal groove. And that laminal groove is going to serve as for the erector spinae and more so the transverso spinalis. But you have the multifidus right in here, and the rotatores. And then because the erector spinae is coming in more of a lateral portion. And that's all for my video this week. I hope you leave some comments. Thank you very much.